Thank you very much for my old friend, Dr. Hao. I remember the good journey when I went to Spain in 2015. It was a very good and very good memory. I still remember it. So today, my topic is focused ultrasound ablation for the treatment of postpartum placenta inquitor and subsequent pregnancy outcomes. I come from Central South University and the Xiangya Hospital. HIFU is also called focused ultrasound ablation. Dr. Lang called this focused ultrasound ablation is Chinese technology, Chinese manufacturer, and Chinese brand and Chinese standard. This is a number of blind and malignant cases we finished in our hospital. Last Saturday, we just finished the 9,000 cases. And we finished about 306 cases of placenta inquitor. This is a definition of the placenta inquitor, and it can be classified into placenta inquitor, and placenta precautions. We must make sure when we write the article in the SCI or in the paper, because mainly publications before the doctors write placenta inquitor. No, placenta inquitor, in my opinion, is no need for HIFU. Placenta inquitor is very good for HIFU. So a case, this is a 25 years old woman. She is admitted in our hospital in October 26, 2020. The chief complaint of here is vaginal bleeding after labor, induced labor and carriage for 1 month. On September 26, 2020, induced labor due to premature rupture of membranes, and the placenta was not detached. Manual removal of the placenta under ultrasound, and the vaginal bleeding is more than 1,020 millimeters. So all the drugs and the Chinese traditional medicine was used for 1 week. On October 16th, our ultrasound found mixed mass C in the upper and middle segment of uterine cavity, measuring 59 multiple 50 millimeter with unclear boundary with the uterine and the posterior wall. So there is no significant past medical history, personal history, and family history, and her menstrual history. There is no significant normal. But marital history is gravid 2, preoperative 1, and abortion 1, and still have fertility desire in the future. So the normal body temperature, blood pressure is normal, and the vaginal examination, a small amount of bloody and odorless liquid in the vagina, and the uterus is enlarged to the size of 2 months of pregnancy, and the low tenderness on the uterus, and no obvious abnormalities are palpated in the bilateral anexa. The HCG is a little bit higher than the normal level. It's 80 units per millimeter. So another MRI is performed. An irregular mass was seen in the left uterine wall and the left wall of the uterus, with a range about 5.6 multiple 5.0 centimeter. This is the MRI picture before the HIFU treatment. We can see the left uterine wall, we can find about 5 millimeter placental tissue. And this is the enhanced MRI picture. We can see the blood supply in the placental tissue. The administration, according to the symptom, physical signs, and the examination, the administration diagnosis is postpartum placenta inquitor. There have many treatment methods for placenta incubator: surgical treatment, interventional therapy, and drug therapy. So I think HIFU treatment is a new therapy. From 2011, there have been more than 10 articles published at home and abroad, including 300 cases of successful application of HIFU in the treatment of postpartum placenta incubator. There have many advantages. Just Dr. Jody said, non-invasive, non-radio active pollution and real-time monitoring. So it's a novel non-invasive therapy for placenta incubator. HIFU and expectation treatment is used for this patient. On October 26, 2020, HIFU treatment of placenta incubator was performed. Treatment time is 132 minutes, and the salutation time is 922 seconds. This is the picture before they have treatment. There we can see the ultrasound. Under ultrasound, there have blood flow in the placenta tissue. After they have treatment, the blood supply is disappeared. So the patient take 1 week of oral antibiotic drugs after treatment and advised to follow up regularly in the outpatient department for expectation treatment. There was intermittent discharge of a small amount of pregnancy tissues without abdominal pain or vaginal bleeding. On March 7, 2021, about 4 months after treatment, MRI was performed, showed no obvious residue, and there were no significant change in her menstruation. Her last menstrual period was on April 10, 2022. She became pregnant naturally, and she got a cesarean section on January 10, 2023. There was a small amount of placenta residue during the surgery. This is the picture 4 months later, 4 months after the HIFU treatment. The placenta incubator tissue is disappeared totally. The preoperative management and the scales of focused ultrasound ablation for this disease. First, the MRI and the ultrasound before the treatment is needed, and no active vaginal bleeding. The vaginal bleeding must less than the normal menstruation, and whether the body temperature is high, because we must exclude the acute inflammation disease. And pay more attention to the focus point during the HIFU treatment. Keep the distance of 1 point at least 1.5 centimeter between the serosome layer and avoid excessive ablation damage to the uterine surface. So, if there is no obvious infection and massive bleeding, it is suggested that no carotid after HIFU treatment. Follow up 1 to 3 months after treatment, waiting for the natural discharge of the lesion. It is important to actively prevent infection for 7 days. And the drug for promoting uterine constriction, such as Chinese traditional medicine or estrogen, can be given orally to promote the discharge of the retained pregnancy tissues. And monthly checked up the blood routine, color Doppler, ultrasound or MRI and other examination. If it not discharged for more than 3 months, it can be further treated. It can be further treated by hysteroscopy. And there are the outcomes, the pregnancy outcomes of this disease after HIFU treatment. There are 2 reports on the outcome of subsequent pregnancy after HIFU. The first one is they treated for more than 40 40 cases, and 18 patients have future reproductive plans, and 7 of these patients become pregnant and delivered and full term. And another literature reported that they treated 95 cases and 9 patients were delivered and full term. And in our hospital, there were 70 patients have fertility desire after HIFU treatment, and 30 of them become pregnant, and last 40 patients delivered and full term. 3 of them have placenta incubator this time. Maybe more data are needed to confirm its impact on the endometrium and subsequent pregnancy outcomes. As a new therapy, HIFU has been proved to be safe and effective in the treatment of postpartum placenta incubator. For patients who have fertility requirement, there are small amount of patients on the outcome of subsequent pregnancy after HIFU treatment. Maybe more data are needed to confirm its impact on the endometrium and subsequent pregnancy outcomes. That's all. Thanks for your attention. Thank you.